Hello everyone. So today the topic of discussion is ADR, that is adverse drug reaction. It is one of the important topic of general pharmacology. Before that we studied about pharmacokinetic, pharmacodynamic. Now we will study about adverse drug reaction, which is commonly known as ADR. One long question comes under this heading, that is explain in detail about adverse drug reaction. We will see this topic in detail today. Before that, please do like, share and subscribe. So the content under which we are going to study adverse drug reaction is definition about adverse drug reaction. Second, how adverse drug reaction is classified, that is classification of adverse drug reaction. We'll study about drug allergy, which is itself a short answer question. And lastly, extra point, that is about other adverse drug reaction. So these are the four broad heading under which we are going to study adverse drug reaction. Introduction. All drugs can produce unwanted effect. The definition of adverse drug reaction is any response to a drug that is noxious and unintended and that occurs at dose used in human for prophylaxis, diagnosis and therapy. All drugs can cause adverse effect. Some patients are more likely to show the effect. So whenever we use the drug, all people do not develop adverse drug reaction, but some people can develop adverse drug reaction. Now we will look how adverse drug reaction is classified. They are classified under five broad heading, that is type A, type B, type C, type D and type E. Type A, it is also known as augmented type of reaction. Type 1 are the bizarre type. Type C is the chronic use. Type D is the delayed type of adverse drug reaction, and type E is adverse reaction due to end of use of that drug. So this is how adverse drug reactions are classified broadly. That is type A, type B, type C, type D and type E. Type A, which is the augmented reaction, it is related to the pharmacological effect of the drug. This type of reaction, it is predictable, it is dose related and quantitative. For example, hypotension, which is caused with the use of alpha blocker, hypoglycemia due to insulin, bleeding due to anticoagulant. Most of these reactions are reversible either by reducing the dose or by stopping the drug. Type A, that is augmented reaction, is further divided into three types. The first one is the side effect, second one is the secondary effect, and the third one is the toxic effect. So we will study each these three type in detail, that is side effect, secondary effect and toxic effect. In augmented type of reaction, the example we have seen is insulin causing hypoglycemia, beta blockers or alpha blocker causing hypotension, bleeding caused with the help of anticoagulant drug. Now we will study about side effect. Side effects are unwanted effect. They are extension of the pharmacological effect. They are seen usually in the therapeutic dose. So we call it as an side effect. They are predictable, common, and can occur in all people. Example of side effects are hypoglycemia, which is due to insulin, hypokalemia following furosemide, hypocalcemia with the help of loop diuretics, then hypotension with the help of alpha blocker. So these are the examples of side effect. Side effect is different from the secondary effect. Side effect is predictable, while as secondary effect it is an indirect consequence of the primary drug action. For example, superinfection due to use of broad spectrum antibiotic. Irrational use of broad spectrum antibiotic results into decrease in the immunity by destructing the common cells which are present in the intestine. As a result, person become prone for superinfection. Another example of secondary effect is use of broad spectrum antibody cause vitamin K deficiency. Third, it is toxic effect. Toxic effect, the word itself says that they are seen on the higher doses. This toxic effect can be serious. The name itself suggests toxic can be serious. Example, use of morphine in an excess causes respiratory depression, and this respiratory depression due to respiratory failure can be fatal to the person, and that can result into death of the person. The second type of adverse drug reaction, it is bizarre reaction. Type B, B stand for bizarre. So these are unrelated to the pharmacological effect. Like in type A, they were related to the pharmacological effect. Type B are unrelated to the pharmacological effect. So they are not predictable, but they are less common. If even if they are less common, but they are not tolerated and are abnormal drug reaction. The type of the bizarre reactions are idiosyncratic, which are genetically mediated, and second one is the allergic reaction, which are immunologically mediated. Idiosyncrasy, as I have told, they are genetically mediated abnormal reaction. For example, primaquine and sulfonamide induce hemolysis in a patient with G6PD deficiency. Some patients shows excitement with barbiturates. Barbiturates are known to suppress the excitement, but some people develop excitement with the use of barbiturates. Chloramphenicol induce agranulocytosis, which can cause an dose-limiting side effect of chloramphenicol. Some patients are highly sensitive to low doses, and some patients are insensitive to high doses. So this all comes under the category of idiosyncrasy reaction. Allergic reactions are immunologically mediated reactions that are not related to the therapeutic effect of the drug. Drugs or its metabolites itself act as an antigen, and that antigen induce antibody production, which results into allergic reaction. Subsequent exposure with the same drug may result into allergic reaction. Manifestations are mainly seen at the target organ. For example, if the drug is targeting any kind of organ, the side effect will be related to that kind of an organ. For example, isoniazid causes hepatotoxicity. Type C. Type C, it is due to chronic use of the drug. Occurs due to prolonged use of the drug. Drug dose and duration can affect this ADR. For example, chloroquine induced retinopathy, Cushing syndrome, and analgesia neuropathy. Chloroquine, when used in case of rheumatoid diseases, rheumatoid bone diseases, it can induce retinopathy. Type D is the delayed effect. It occurs after stopping the drug. Sometimes this side effect can even occurs after years. For example, if the person is having treatment for Hodgkin lymphoma, in later year the person can develop leukemia. Another example of delayed effect, it is teratogenicity. So these are the example of delayed type of adverse drug reaction, that is leukemia induced due to Hodgkin lymphoma, treatment and teratogenic effect. The last type of adverse drug reaction, it is a type E type, which is end of the use. This occurs after sudden discontinuation of the drug after prolonged use. For example of type E, it is adrenal insufficiency after stopping glucocorticoid, and angina after sudden withdrawal of atenolol. So, adrenal insufficiency is seen after stopping the glucocorticoid drug. So, this is the example of type E type of adverse drug reaction. Now, we will study in detail allergic drug reaction. Allergy can be mild itching type, or it may develop till the anaphylaxis. Allergic reaction can induce both type of immunity. For example, humoral immunity as well as cell mediated immunities. There are four types of hypersensitivity reaction: type 1, type 2 and type 3, which are humoral mediated. Type 4, it is cell mediated type of allergic reaction. Type 1 reaction, which is also called as an anaphylactic reaction. The drug induces the synthesis of IgE antibody which are fixed to the mast cell. On subsequent exposure to the antigen antibody complex are formed which causes degranulation of the mast cells, releasing mediators of inflammations like histamines, leukotrienes, prostaglandins, and platelet aggregating factor. As a result, the signs like bronchospasm, edema, and hypotension are seen. So the common signs of type 1 reaction, it is bronchospasm, edema. Now second type of allergic reaction, it is cytotoxic reaction. Drugs bind to the protein and act as an antigen. This resulting into the formation of antibody. Antigen antibody sequence activates the complement system resulting into cytolysis causing thrombocytopenia, agranulocytosis and aplastic anemia. The common examples of type 2 reactions are myasthenia gravis, blood transfusion reaction, pemphigus vulgaris, ANCA mediated vasculitis. Type 3, it is the arthros reaction. Antigen bind to the circulating antibody and this complex are deposited on the vessel wall. When they are deposited in the vessel wall, they initiate inflammatory response in that vessels resulting into vasculitis. Examples of type 3 reaction, it is serum sickness, Henoch-Schönle's purpura, anthrus reaction and vasculitis. Last type of allergic reaction, it is delayed type of hypersensitivity reaction, which is T cell mediated or macrophage mediated. Antigen react with the T cell receptor present on the T lymphocytes, which produce lymphokines leading into allergic reaction. The examples of this are contact dermatitis, multiple sclerosis, inflammatory bowel disease, vasculitis, tuberculin test, lepromine test, psoriasis, patch test, sarcoidosis. Other types of adverse drug reactions are drug intolerance, iatrogenic diseases, drug dependency, teratogenicity, carcinogenicity, and mutagenicity. And last type is toxicity to organ. We will see this in detail each and every types of adverse drug reaction. First, we will study about drug intolerance. Drug intolerance, inability to tolerate the drug even at the therapeutic dose, and this is unpredictable. The, to- the heading itself tells drug intolerance means patient is not tolerating the drug even at the therapeutic doses. This can be quantitative or it can be qualitative. Quantitative intolerance means even a single dose of streptomycin can cause vestibular dysfunction. Qualitative intolerance can be studied as idiosyncrasy and allergic reaction. Second type of adverse drug reaction, it is iatrogenic disease. It is also called as a physician induced disease. So drug induced diseases. For example, doctor putting a patient on a drug and that drug causes an adverse drug reaction. So this is called as an physician induced adverse drug reaction. Even after drug withdrawal, the toxic effect persists. For example, chloroquine induced hepatotoxicity and isoniazid induced hepatotoxicity and chloroquine induced retinopathy. Isoniazid is commonly used drug in tuberculosis which can result into hepatotoxicity. The third, it is drug dependency. Drugs that alters the mood or behavior of the patient are often misused. Repeated use of this drug can cause dependency. Dependency can be physical or physiological. Physiological dependency is compulsive drug seeking behavior to obtain its pleasurable effect. So psychologically the patient go under the control of the drug and to obtain that drug the patient undergoes psychological changes. Second dependency is the physical dependency. The body itself undergoes physiological changes to adapt itself to continue the presence of the drug results into withdrawal effect which disturb the patient and the person's craving for for the drug. So this was all about physical dependency. Now we will study about teratogenicity, ability of the drug to cause the fetal abnormality when administered to the pregnant woman. It is called as an teratogenicity. Example, thalidomide taken by the pregnant ladies to prevent morning sickness result in babies born with phocomelia, which is the seal limb. So this teratogenic effect are further divided under three headings or how the drug affect the developing fetus in the mother womb. So based on the stage of pregnancy, the teratogenicity present between conception to the day 16 of the life, it usually resists this phase of the life is usually resistant to the teratogenic effect. But if the fetus is affected during this phase of the life, it can result into abortion. Second is the period of organogenesis, which is from day 17 to day 55. It is the most vulnerable period because this is the period of physical development, and teratogenicity during this period can cause physical abnormality. This is how phocomelia looks like, which is nothing but the seal limb. This was seen with the use of thalidomide for morning sickness in early 20th century, resulting into stoppage of the drug during pregnancy. Thalidomide is usually used in case of lepra reaction treatment. So this is how the baby of phocomelia looks like. One of the most dreaded teratogenic effects seen into the humankind. The fifth adverse drug reaction are carcinogenicity and mutagenicity. Carcinogenicity, the word itself says cancer causing. Mutagenicity or mutation inducing. Drugs causing cancer and genetic abnormalities comes under the side effect of carcinogenicity. Example of carcinogenicity is radioactive hormone which are used usually in the thyroid disorders. So this was all about carcinogenicity and mutagenicity. Last one is the drug affecting the organ. For example, neurological side effects are seen with the use of isoniazid, haloperidol, quinine. Behavioral abnormalities are seen with use of steroid. Ocular side effects are seen with chloroquine toxicity. Ototoxicity is seen with aminoglycoside. Dermatological side effects seen with doxycycline. Cardiovascular side effects seen with digoxin. And respiratory side effects are seen with bleomycin. So this is how drug target particular organ resulting into side effect of that organ. GIT, which is affected by opioid and antibiotic, steroid again causing muscle toxicity, chloramphenicol causing hematological side effect that is a granulocytosis, methyl dopa resulting into endocrine abnormalities, mineralocorticoid causing nephrogenic side effect, and prazosin causing sexual side effect. So this is how drugs affect particular organ system which comes under another adverse drug reaction. So this was all about adverse drug reaction. I hope you like this topic, you enjoyed this topic. Do don't forget to like, share and subscribe my channel. Thank you. In upcoming lectures we will see about various types of antihelminthic antifungal drugs. Thank you.